This exercise is jaw isometrics. So isometrics are a type of exercise or muscle contraction where essentially like the joint is not moving. So if I were going to do an isometric contraction for my elbow, this is one for my bicep where like I'm like the muscle is making generating force, but the joint like isn't moving. Isometrics are amazing for decreasing pain and can be a really helpful tool at the beginning of someone's like plan essentially. So we're gonna do isometrics for the jaw. It's a little bit harder to see that this joint here versus like the elbow, but works in a similar way. So we're gonna do isometrics in a couple different directions. So jaws, when they're irritated, can be like pretty sensitive to like changes in like how open your mouth is. We're looking to do these in a range that is not painful. We want to make sure that we aren't increasing pain as we're doing this. So we're going to find both a like mouth open position as well as a like force that is like a 0, 1, or a 2 out of 10 in terms of pain. If 0 is nothing and 10 is the worst. So the first one we're going to do is an opening isometric. So jaw is going to open just a little bit. And then you're going to hold your hand up underneath your jaw, and I'm going to press down into my hand. And it's okay if pain like bumps up just a little bit at the beginning of this. It should be 0, 1, or 2, but as you hold, that pain should decrease a little bit. If it starts to increase, you're either applying too much force, your mouth is too open, or something else needs to happen first. This exercise isn't for absolutely everybody. So jaw opening is going to be the first one. Jaw deviating to the side is going to be the second one. And we're going to start with just a little bit of range. So you're going to push your jaw to the right side, just barely, and your hand's going to push against it. We're going to go to the other side, same thing. And we're going to start out with like not very much range at all. We're just contracting those muscles to help with pain relief and to help sort of set the stage for some healing to happen. And then the last one that you're going to do is going to be a closing jaw sort of mobilization. So you can put something in your mouth, you can use a finger, but like essentially you're just going to gently close. Not super hard, not super duper hard, just a little bit. So for those isometrics, you're going to hold each one for anywhere between like 15 seconds all the way out to a minute. If you get to 15, you're doing okay, keep going. If you start to have some pain, go ahead and taper off. You're going to wait a little bit, let's say a minute between each round of those, and you'll do a few rounds. Again, pain should decrease as you go through these. If it increases, tell your PT something needs to change.